In Kenya, for many years, communities in Western Kenya and its environs have been using traditional ways of umbilical cord care for newborn babies. Ash, cow dung, mud, and even soot would be applied on the cord, which could cause fatal infections. However, communities are now embracing the new method of using chlorhexidine jelly, or CHX, on newborns. This new method helps the umbilical cord drop in less than 5 days and protects the baby from infections. Correspondent Victor Maturi has more from Busia County in Western Kenya.
These sounds of birds welcomes us to Bunandi village in Busia County, near the border of Kenya and Uganda. Here, the community is embracing the new method of cord care using chlorhexidine jelly for the newborn babies. Chlorhexidine is an antiseptic jelly applied on the newborn umbilical cord to prevent sepsis, which is one of the leading causes of neonatal death in Kenya and East Africa at large. Beatrice Akuku is a mother of 7 children, and she has used this method for her latest child. Beatrice says she has been using the traditional method for her last 6 children, and it took long for the umbilical cord to heal.
For my first 6 children, I used dust to apply to the umbilical cord because that's what I was shown by my grandmother. I used it for 2 weeks and it wasn't healing. I started using powder, and again it wasn't healing quickly like the current chlorhexidine jelly that I'm using. I was given this jelly at the hospital, and the doctor advised me to apply it after washing my baby. I used it for 3 days, and after 1 week, the cord was healed.
Few meters from Beatrice's homestead, Jacqueline Cherotich, a mother of 4 children, is one of the many women who have started embracing the new method of umbilical cord care. She says it took just 3 days for her last 2 children to heal.
I used to deliver at home, and my grandmother would use a piece of cloth to tie the stump of umbilical cord of my babies. It took a long time for the cords to heal, and she would tell me to apply fine and soft mud to soothe it. The umbilical cord took 2 weeks to heal. I started using the modern method for my 3rd child after delivering at Nangina dispensary. After 1 week, the cord was fine. The modern method is working well for me.
Thousands of indigenous communities in Western Kenya and its environs still practice their tradition during delivery, such as applying cow dung on the umbilical cord, soil, lizard droppings, herbs, comestic powder, or sometimes tying a piece of cloth around the umbilical cord. Margaret Nabwiri Makoha is one of few remaining midwives in this village of Bunandi, explains.
We used to tie the baby's umbilical cord 3 times using a piece of cloth to prevent blood coming out. Then we would wash the cord with salt water until it falls off. My colleagues were using soot and cow dung, but we realized children could develop problems, so we continued using salt water for a long time. But nowadays things are okay. We've got hospitals around. During our times, there weren't any hospitals. We'd have to walk hundreds of kilometers to Busia or Kisumu towns for someone to get medical services because there were no vehicles.
Locals say the lack of hospitals is the primary reason many women continue embracing traditional ways of cord care in Western Kenya. However, with the help of community health workers, residents in this area are now receiving cord care and other medical services in their homes. Roslyn Anyango Makoha, a community health volunteer in the larger Bunandi village, has been training women on how to use chlorhexidine jelly on their newborn babies at home.
Previously, women used traditional medicine to heal the umbilical cord because culture and religion was forbidding them to use other methods. But now the world's changed. Nowadays, we even call to meet the women at schools to educate and train them in the new ways of cord care. My appeal to women, I urge them to deliver at hospital. The days of delivering at home are over.
At the Teso North Sub-County Hospital in the outskirts of Busia County, nurses are busy attending to the newborn babies in one of the wards. They are applying chlorhexidine jelly on the baby's umbilical cords. Judith Amoit, a mother of 4 children, just gave birth 1 day ago. She says it is the first time she is delivering in hospital.
For my first 3 children, I used ash from the kitchen to apply to the umbilical cords, and it used to take 1 week for the cord to drop. Now I want to compare which method works best for me. If it's the chlorhexidine jelly, that's what I'll be using. But if the traditional one is better, then I'll stick to it.
During pregnancy, the umbilical cord supplies nutrients and oxygen to the developing baby. After birth, the umbilical cord is no longer needed, so it is clamped and snipped. This leaves behind a short stump. The baby's umbilical cord stump then dries out and eventually falls off. Tezra Okal is a nursing officer in charge of maternity wing here at Teso North Sub-County Hospital. She tells us about the process of applying chlorhexidine jelly on baby's umbilical cords.
So immediately the baby is born, we apply CHX in the delivery room. So we apply the CHX from the root of the cord and the part that we've cut on top of the cord. So we apply once in a day up to when the cord drops, or for at least 7 days. But in most cases the cord drops below 7 days. Within the first week the cord is dropped. The first application is done by the health worker who conducts the delivery. Then the following day we distribute the CHX to the women and give a health education on how to apply.
Tezra says in spite of the traditions in this region, communities are now adapting the new method.
There has been no resistance on CHX. So it was received and it's still being received and is taken positively by the women. We do not have any negative challenge or negative acceptance by the community. It could only be a challenge if the financial part will be there. It is free. If there was any cost implication, the community cannot take it.
Data from Kenya Demographic Health Survey shows that at least 1 in every 45 children born in Kenya dies before reaching the 50th birthday. The level of under 5 mortality is 22 deaths per 1,000 births. David Gidinji, who is a medical project officer at Save the Children organization, says sepsis or infections are a major cause of newborn deaths in the first 2 weeks of life.
You realize that after delivery, the umbilical cord now is of no use, and it is usually cut immediately in the health facility by the healthcare provider. We have to take care of the cord because that's where most of the infections get in a newborn. We have been having so many cases of neonatal sepsis through the umbilical cord, and when chlorhexidine was introduced, it has shown that it reduces the umbilical cord infection by around 68%.
Apart from Kenya, countries like Uganda, Tanzania, Burundi, Rwanda have also started embracing this new method of cord care for newborn babies. Save the Children, an organization which has been championing this new initiative in partnership with the government of Kenya, says 30,000 children have benefited from this treatment in Western Kenya. Kidinji says plans are underway to roll out the program countrywide within the next 5 years.
After piloting in Bungoma and Busia counties, it was shown to be very effective, and we were able to now to scale up to other counties. Currently we are scaling up to 18 counties. And this we do with support from the national government. We don't implement that alone. And by doing that, the chlorhexidine indicators have also been included in the Kenya Health Information System, where now counties are able to report the consumption of chlorhexidine in the whole country. Now communities have already accepted the use of chlorhexidine, and we have really seen that neonatal sepsis has reduced even at the community level.
As this new intervention continues to help thousands of babies in Kenya, experts are now calling on African governments to embrace the initiative to curb neonatal sepsis cases in the continent. Reporting for RFI's African Calling, this is Victor Muturi in Busia County, the border between Kenya and Uganda.